Thanks, John. Again, while Dermot's lining up some really good, strong messages about losing our way and losing momentum. So I'm just going to ask Dermot King. Dermot represents the National Voluntary Drugs and Alcohol sector, which Breed made a call out there. Many Section 39 organisations that you'll be familiar with, not statutory, but providing fantastic services. So Dermot, 7 minutes, over to you.
So good morning. Thank you very much for inviting NVDAS to speak this morning. The National Voluntary Drug and Alcohol sector is a national representative body for voluntary sector organisations in Ireland working in the area of drugs and alcohol. And when we say voluntary services, it means voluntary and the community services. So it's distinct from the statutory. So it's a broad range, but the key is that word voluntary and where they came from. There's more than 60 member organisations right across the country, and we deliver services and support across the 4-tier model of service delivery, which has probably been mentioned at some stage. So what do we bring as NVDAS to this morning's conversation? So we represent voluntary service. So what does that mean? Voluntary services began with people recognising needs that were not being met and deciding to come together to respond. So we're responsive. Voluntary services are developed by people on the ground who experience or have experienced or witnessed the problem. So we're informed and pragmatic. Voluntary services have had to work closely with others from the start to access resources and to build support in local communities for services being developed. So we're collaborative. Voluntary services have changed and developed as needs developed or new challenges came up. So we're versatile and agile. And voluntary services tend to be smaller and more local. And so what they do is always visible to individuals, to families, to communities that they serve. So we're accountable. And finally, NVDS, we have, as the organisation, we have a national perspective. The members come from all over Ireland, and they bring to conversations such as this and other forums the experiences and the challenges from all of those different contexts. So from our perspective, what's working? The voluntary sector has been creating and delivering innovative and creative services for more than 40 years in response to the drug and alcohol issues. The voluntary service offers a wide range of responses along a whole continuum of needs, which we've been talking about here all the time, whether focused on prevention, education, harm reduction, stabilisation, abstinence or recovery. And as was also mentioned this morning, it's a service to individuals at different points on the level of their drug use. So it's not just one end of it, it's right across the spectrum of different types of drug use. The voluntary sector collaborates with a wide range of providers in health, justice, education, housing, employment, as well as with the local and regional drug task forces. The voluntary sector has the capacity, because we needed to draw in local resources. Sometimes it's about attracting funding, but especially in terms of local people and organisations working together with us. The voluntary sector offers a range of routes for people who have received services to bring their skills and their insight into the further development and delivery of services. So that's what's working from our point of view. What's not working? The voluntary sector, as was mentioned already, is a very significant part of the national response to drug and alcohol use. Yet, as has been mentioned, there's a fundamental inequality between the voluntary sector, funded under Section 39 of the Health Act, and the statutory services. This disparity is most obvious in terms of pay and conditions. And as Breed mentioned just there earlier on, many staff of voluntary sector organisations are moving out of the voluntary sector into better resourced and more secure public sector positions. Funding for voluntary sectors under these agreements are normally annual. They're annual arrangements. So planning and development, as well as consistency of service delivery, is increasingly challenging because of that. And the sense that funding is never secure, even in the medium term, makes staff retention even more difficult. As a national body, NVDAS is very aware of the significance of where a person lives when it comes to accessing a response to their drug or alcohol-related needs. Access to treatment and support after treatment becomes much more difficult when services aren't available locally. In the voluntary sector, and especially in community settings, the impact of substance use on families is hugely evident. And yet, the NVDAS experience is that support for families isn't being prioritised. Individuals, families and communities are all impacted by substance use, as you've heard already so many times. So an effective joined-up response needs to address all three dimensions. In a changing funding environment, there has been talk of a commissioning of services. This has been an approach used in other jurisdictions. NVDAS believe that this fundamentally undermines the ethos and the practice of the voluntary sector. Effective and creative collaboration is profoundly eroded by a model that pits organisations against each other in accessing resources. The model is also based on very limited outcome indicators, which are incapable of doing justice to the complexity of responses available through drug and alcohol services. Again, it's up at the next assembly, but NVDAS agree with many contemporary voices that the criminalisation of drug use continues to create enormous obstacles to an effective response to drug and alcohol use. So from an NVDAS perspective, what should we be doing more of?
Just 1 minute, please.
NVDAS supports the continued development and implementation of a health diversion programme, but moving beyond the one chance model. If drug use is a health issue the first time, it's a health issue the 100th time. NVDAS members are involved with and believe in collaborative working. Often individuals are linked to different services, including both statutory and voluntary. Recently there have been initiatives, and we'll hear more about them, to link these engagements more effectively, including through integrated care plans and case managements. But there still exist institutional blocks and practices that tend toward the isolation of services. Joined up thinking and practice through collaboration needs to be promoted more actively among all services, particularly in relation to the statutory and the voluntary involvement. Sláinte care, right place, right time, and the no wrong door approach to mental health, they're crucial to an effective response. The voluntary sector has services right across the continuum of needs and recognise there are different goals in drug treatment. NVDAS believe that we need to continue to move beyond a one-size-fits-all response to drug and alcohol use. So thank you very much for giving NVDAS time to present to this Assembly, and also to all of you for giving time to commit to exploring these issues in this discussion. Further details will be available on the submission that we make then to the website. So thank you very much.
Thank you, Dermot.